focus to Breast Cancer Awareness Month. It is October 1st. And get this, 75% of breast cancer cases occur in what experts refer to as sporadic, women that do not have strong family histories of breast cancer.
And this is why experts say it's so critical for women to be very aware of their bodies. And on this Medical Alert Breast Cancer Awareness Day, we want to encourage you not to be embarrassed or afraid to ask questions.
So I do encourage my patients to know their breasts, not to be afraid to perform a clinical breast exam. But I also want my patients to know that because there is such tremendous awareness about breast cancer, that they don't have to feel afraid to come to the center, whether they have a concern or a question.
One Hollywood celebrity, Angelina Jolie, has made a huge impact on breast cancer awareness.
Jolie had a prophylactic mastectomy in March 2013, choosing to remove both of her breasts to reduce the risk of developing breast cancer since her family carries the mutated gene.
We can kind of refer to it as the Angelina effect, and basically what that is that once she came forward with the fact that she is a carrier of one of these defective genes known as BRCA1 or BRCA2, what that really triggered was women to sit down and think, gee, do I have a family history of breast cancer? Should I be concerned?
And due to Jolie's brave decision, the number of women that have come forward asking experts like Dr. Moss-Mehlman for gene counseling and genetic testing has doubled.
I think one of the most important things when a woman comes to a breast center and they're feeling all anxious about their studies is personalized care, feeling that they are an individual and their care is going to be very well coordinated from A to Z.
So the message this October, do not be afraid.
Know that here in South Florida, you do have a support system.